Hey guys, my name's Sam, welcome to PrepMedic. Today, we're gonna work on saving you some money. So in front of you, I have 3 items that are commonly found in advanced medical kits sold online. We're gonna be discussing each of these items and if they are really worth the extra $100 these could add to your kit. So when you go online to buy an IFAK, an individual first aid kit, you are confronted with a number of different purchasing items depending on the distributor. So usually you'll have a basic option, intermediate option, and an advanced option. And these 3 items in front of you are usually the difference in those 3 kits. Now, the variation in price will depend on the distributor you're using. A lot of what I'm talking about as far as specific pricing is coming off North American Rescue's website. And when they have a basic kit, that kit is going to come with compact gauze, a tourniquet, and then some kind of space blanket, usually gloves, and a trauma dressing of some kind. When you go to their intermediate kit, it stays the same, but they add quick clot gauze. And then if you go to their advanced kit, you're going to get usually an ARS needle and a nasopharyngeal airway. And this holds true over a couple different companies. The difference in price is usually somewhere between $50 and $100 between the basic kit and the advanced kit, with the basic kit starting around $100. So that is quite a large variation for 3 pretty small items. So in this video, I want to talk about each of these one by one and figure out if they are right for you, if you should be carrying them, or if you can save your money and go with one of the smaller kits instead. So let's start with the ARS needle. So an ARS, or decompression needle, is a very long needle that's meant to be inserted into somebody's chest who is experiencing a tension pneumothorax. A tension pneumothorax is the buildup of air in the chest cavity that causes the compression of the mediastinum. This is a state known as obstructive shock and will lead to death if left untreated. Tension pneumothoraces are oftentimes cited as a leading cause of preventable combat casualty deaths, but its numbers pale in comparison when we look at things like massive hemorrhage and other causes of preventable death. Even so, that is oftentimes why it is found in these IFAK kits. Now, should you spend your money on this device? These generally range between $5 and $25 when you buy them online individually. My answer, and the short answer, is going to be no. I do not think these are worth it for the average IFAK of a random person walking down the street in any US or first world country. Simply because, one, our recognition of tension pneumothoraces is very difficult, especially if you don't have any kind of diagnostic equipment available. You're not able to auscultate. You're not able to look for vital sign changes beyond a heart rate. Chances are, if you have a deteriorating patient in a traumatic situation, that patient is experiencing massive hemorrhage, and this is not going to do anything but give them a nice little porcupine quill coming out of their chest. Number 2, the rate of failure on these, even with trained individuals, trained paramedics, is upwards of 50 to 80%. These can be misplaced very easily, causing much more harm than good. And you know, one of our first tenets of any kind of emergency care is first do no harm. So one of these inserted directly into the myocardium is going to cause problems. Third, the rate of onset of a tension pneumothorax was once thought to be very, very rapid, within seconds of the injury. Some recent data coming out is starting to suggest that the onset of a tension pneumothorax might be upwards of 15 to 30 minutes. So this is not the first life threat we're going to be addressing. Once again, the chances that this patient is experiencing massive hemorrhage dwarf the chances that this is a tension pneumothorax. Here's where some nuance comes in on this conversation. You have a patient that experienced massive traumatic injuries and they're in cardiac arrest and you're attempting resuscitation. If you don't have blood or any kind of advanced capabilities with you, there is something to be said for the ability to do bilateral needle decompressions to see if there is a preventable cause of death, such as a tension pneumothorax present, that could be fixed with this device. I'm not advocating for anybody to go out and do this totally untrained, not having any kind of formal education behind it, because there is a lot of liability associated with that. So long story short, you can definitely have one of these, but honestly, for a vast majority of people carrying IFAKs to be more prepared, I do not think these are a viable intervention for you. Next up, let's talk about an NPA, a nasopharyngeal airway. So this is an airway that is meant to be inserted into the nose and sits at the back of the nasopharynx, hence the name. Now, this airway does not protect the airway in any way. It does not stop any kind of secretions from getting down into the lungs or aspiration. But we use it to circumvent the tongue and other kinds of anatomical airway obstructions that might be present in a patient that is unresponsive or has an altered level of consciousness. While this device does come in a variety of sizes, you'll notice the one I'm holding up in front of you is a 28 French, and this solo NPA is what you're going to see in most civilian first aid kits. One thing you have to realize with civilian IFAKs is that they are all based off the military versions, and in the military, the majority of people these kits are being used on are military-aged males, hence the 28 French, which is designed to fit a military-aged male. But if you come to a civilian population, we have, wives, kids, extremes of ages and sizes, and a 28 French will only fit a percentage of the population. That's why I think it's important in the US, if you are carrying a NPA in your kit and you have other people around you, you need to look at them and decide if you want to get different sizes. You have to be aware of the limitations here because this is not going to work on everybody. Now, if this is just for you and your buddies at the range and you're all the same size and you fit this, great, go right ahead, but you have to be aware of the limitations. There are some risks associated with the NPA, and again, I'm not encouraging you to go out and use this if you're totally untrained. I'm not a lawyer. I'm not going to tell you about the intricacies of the Good Samaritan laws and whether this would fit or not. But you do have to be aware of potential liabilities there. Now, the actual risk of this device is relatively low. We used to think that if we put this in a patient with a facial injury that might have a basilar skull fracture, we might actually push it up into their brain. And that has happened with nasal tubes for feeding. So your NG tubes. Now, with those tubes, they are much, much smaller lumen, and they have some data to suggest that those have been inserted into the cranial vault on multiple occasions. With these, we still say don't insert them in massive head injuries, but gone are the days of not inserting them just because they have a laceration on their forehead. So there is a risk that you have to be aware of, but unlike the needle decompression, the risks are relatively small, and this is a pretty simple procedure to perform. I do have a video on this that you can check out down below. So the last item, and probably what's going to add the biggest cost to your first aid kit, is going to be quick clot or combat gauze right here. So this is hemostatic agent, and both of these are the exact same. You have some other brands like Celox out there that makes hemostatic agents as well. And this usually takes the place of your compressed gauze in the pack. Now, for comparison, when you look at compressed untreated gauze, you're looking at spending between 50 cents and $5 on that. And with these, you're looking at spending anywhere between $30 and $60 depending on what the economy is doing. In 5 years, who knows what these will cost. So with that pretty substantial price tag, is it worth throwing these in your kit? The short answer is yes, but again, there is some nuance here. When we're talking about packing wounds, so when we're talking about packing junctional sites, so the base of the neck, armpit, and groin, what we know is that pressure is king. Pressure is the most important thing you can do for that patient. That thing of compressed gauze you have in that kit that costs you $2 to $3 will control hemorrhage almost as well as these devices here. The caveat is that these don't have to be held for quite as long. The official recommendations, if you're packing with untreated gauze, is that you have to hold manual downward pressure for at least 15 minutes. When we're packing with combat gauze, they say at least 5 minutes. When we study this gauze in comparison to that compact gauze, there's really no difference in survivability, mortality, morbidity down the road. What it really changes is how long we have to apply direct downward pressure. Now, I'm going to tell you, if you are not in a risky situation, which a lot of these supplies are going to be used in very mundane accidents, motorcycle wrecks, construction accidents, that's where I've seen most of my massive hemorrhage in my career. We're going to hold these as long as possible regardless of the product you're using. So even though you could release these at 5 minutes, I would recommend you hold that direct downward pressure with your hands until you can give that to somebody else that will hold direct pressure with their hands. If we are in a dangerous situation, that's where this changes a little bit, and that's why the military is so quick to adopt quick clot gauze, because in those situations when we're talking, you know, a warm zone where people are still getting shot at, you're out of that direct action, but you have to be doing other things quickly, 15 minutes is a very long time. So the shorter I can hold that hemorrhage, the better. And that's where these come in. Either way, this is definitely a superior product. This is definitely going to stop the bleeding a little bit faster and take some of that workload off you and cover for some of your potential mistakes when we're stressed, you know, whether we let that go or whether we don't tighten that pressure bandage quite good enough. This will cover for you a bit. Where the other gauze will work fine and will still save that patient's life, but it has a little bit less wiggle room, which is why I say, if this is the difference between, you know, feeding your family and not feeding your family, I would obviously not buy this and I would go with the standard compressed gauze because that will work very well. But this is the gold standard. So ultimately, if you had to boil down the advice in this video to one thing, it's that the advanced kits are not necessarily worth it. If money is tight, if you are looking to save a little bit on your preparedness, then these are things you can definitely cut out of the kit. That being said, there are nuances to this conversation, like we've been talking about this entire time. These are the gold standard, and if you're going to buy like one extra thing for your kit and spend a little bit more money, I'd say it's the QuikClot. The unfortunate part here is that the QuikClot is the most expensive part of these extended kits, where the NPA and the ARS needle are much more affordable. With the NPA, just make sure you have multiple sizes and you understand what will work and won't work on different people around you. And then the ARS needle, I maintain if you're not trained in it, it's not worth carrying. There is an argument for, hey, if there's advanced providers on scene and I have advanced things, I might not use it, but they might use it. I'm personally not a super big fan of that approach. If they're an advanced provider, I would rather they use their own things and keep me out of the liability altogether. This is usually used in conjunction with more extensive diagnostic equipment like a stethoscope, a blood pressure cuff, that kind of thing. But like I said, there is an argument for these being used in the undifferentiated traumatic cardiac arrest. So ultimately, guys, those basic kits are great, but you can definitely upgrade them further. I've got links below to these products. I don't make any money off this video other than the ads you might have seen at the beginning. If you have any questions, leave them in the comments down below, and I will see you next week.